new era of healthcare for Ward 7 and 8, a state-of-the-art facility meant to end a decades-long medical desert. But tonight, Cedar Hill Regional Medical Center is under fire. The facility has staffing shortages, leadership turnover, and a safety alert was triggered. Today, the D.C. Council hauled district and hospital leadership into a hearing. Our Matt Gregory is at the Wilson Building this afternoon with a closer look at what went wrong.
So for several hours today, D.C. leaders and Cedar Hill leaders took questions from the council's health committee on why a year later there's still staffing shortages, some ambulances get turned away and some services aren't offered, and why in the case of at least one surgery, a woman had the wrong organ removed. In April of 2025, Cedar Hill opened with so much promise for wards 7 and 8. But as we approach 1 year, testimony revealed in the committee today showed that the hospital has had staffing issues, a lack of outpatient services, hospital leadership has turned over, and surgery issues. And revealed in the hearing today, one woman went in to have her appendix removed and instead had her ovary removed. DC's Committee on Health brought Cedar Hill's leadership in for a hearing today, and part of it was finding out where the breakdown in services is and how to move forward.
One of the things that we're having to talk about is, okay, who's responsible when UHS or the hospital is not meeting the standards of quality of care that was expected and anticipated. DC's Deputy Mayor of Health and Human Services says the problems are growing pains for a new hospital and should be fixed soon, adding that the administrator, Universal Health Services, has been a receptive partner.
They have always been willing to say, look, we messed up here, this is what we're doing to fix it. They've always been, regardless of who was leading it, the previous CEO or now Kimberly, they've always said, this is where we fell down a little bit.
Now, at the hearing today was the interim CEO for Cedar Hill Hospital, and I asked her to talk to us and explain the issues and the solutions going forward, but her staff said no. Now, DC Health will release in the coming weeks its final reports on the issues going on at Cedar Hill and what those solutions look like. We'll stay on top of it. But for now, outside the Wilson Building, I'm Matt Gregory, WUSA 9.
Wow, clearly a lot has to change there. All right, Matt, thank you.